Hello, I'm Katie.
And I'm Dr. Stanley from the Smile Center.
We're going to go over some of your frequently asked dental questions. So, Dr. Stanley, what causes tooth decay?
Tooth decay is caused by a couple of things, and you have to have these couple of things in there to make it happen. So if you have decay, it's going to be caused by bacteria and sugar. So the two things we look for are plaque, which is bacteria, and sugar, which can come from a variety of sources. It's not just candy. It can be potatoes. It can be citric or juices. Anything that has sugar in it or carbohydrates can be converted to sugars that the bacteria then can use. So as the bacteria eats the sugar, it creates acid, and that acid then eats into the tooth. So if a patient is not effectively removing the plaque from every surface of their tooth, any place where that plaque sits and has access to sugars in the diet, it's going to try to create decay. And it becomes worse in patients who have dry mouths, because if the mouth is dry, then the acid can be more concentrated on the tooth and it can eat into the tooth. If they don't have good salivary flow, so they don't have good saliva in their mouth, they're going to tend not to be able to remineralize the tooth, which is an ongoing process. You have to understand that decay is a dynamic process. Our mouth is always being affected by acids, and then it's our saliva that goes back in there and remineralizes, or in other words, makes the teeth hard again, as well as toothpaste with fluoride in them. And again, the main function of toothpaste is to get fluoride onto the teeth. Just not to make it smell good or taste good, it's to get fluoride onto the teeth.
Yeah.
So the fluoride then can also help to reverse that cavity process. So if you have plaque, you have sugar, you need to get that removed. Typically several times a day we want to get that removed. So brushing in the morning and in the evening, flossing in the evening, and using a fluoridated toothpaste are our key tools for preventing decay.
Okay, very important information. Thank you.
You're welcome.